Good evening, you're watching NDTV with me, Rishika Barwa. Over the course of the next half an hour, we will take your questions on the coronavirus. We'll be joined by expert doctors. You can dial in with your questions and the doctors on the broadcast will answer them live. Joining us on the broadcast this evening, Dr. Parminder Singh. He's a professor of diabetes and endocrinology at the Dayanand Medical College and Hospital in Ludhiana. We also have Dr. Sushil Jindal, who's a professor of endocrinology, People's College of Medical Sciences, joining us from Bhopal. Dr. Skand Trivedi, head cardiologist of the Bansal Hospital, joining us from Bhopal. Appreciate you doctors being with us on the broadcast. I want to begin by asking the first question. There's been a very interesting development that has been reported in Kerala today, where 5 people with a travel history to Dubai have tested positive. Now, interestingly, what our reporter Sneha in Kerala is telling us is that the incubation period in Kerala has already been touted to be more than 14 days. So what patients or what people in the time period for which people are being quarantined or self-isolated in Kerala is 28 days as opposed to 14 days. Which is the norm elsewhere. So I want to just, perhaps Dr. Jindal, if I could begin by asking you, if you want to take that on first. What does this tell us? Could the incubation period actually be longer than 14 days? Do we need to have a rethink? Dr. Jindal, can you hear me? All right, we seem to be having some audio trouble there clearly. Dr. Trivedi, would you like to take that on instead?
Yeah. Actually, when we talk of incubation period, the median incubation period is from 1 to 14 days, but the literature is telling us that up till 30 days, a virus has been formed in the patient's body. So while most of the patients will have an incubation period for a couple of weeks, some of them are likely to be up till a month. Of course, these patients will be much less as compared to the common ones.
Right. So, are you in a certain sense then reaffirming the fact that the self-isolation period or the quarantine period should be extended beyond 14 days? Is that something you recommend to your patients as well? Dr. Singh, if you'd like to take that on.
I will say that the whatever period, 14 days is good enough for general population as such. Extending it 28 days, it will be too much as such. And this 28 days, maybe a few patients which are outliers of the curve that you have. Generally, it is 5 days, 2 weeks is the most of the time it is 2 weeks.
All right, very interesting, because 5 patients with a travel history to Dubai returned from Dubai 3 weeks ago, and they've tested positive today in Kerala. So it's interesting because these are 5 patients who have tested positive 3 weeks, and they were quarantined for a period of 3 weeks because the quarantine or self-isolation period in Kerala is higher. That's 28 days. But we'll talk more about that. We have Mariam, our first caller, joining us from Hyderabad. Go ahead.
Good evening. My question is, after the lockdown is lifted in the country and across the globe at large, is there a chance of a relapse, and how will herd immunity come into play?
All right. Dr. Jindal, if you can hear us now, would you like to take that
on? She's asking about whether there can be a relapse.
Yes.
Till now, we do not have many reports of relapse. There are a few very anecdotal reports that after having tested negative, after having spent some 2-3 weeks and disease is over, few patients have tested positive. Second question was regarding herd immunity. See, there are 2 ways the society can develop herd immunity. One is that you vaccinate the society. Second, the ways that patients at large get infected, and many of them develop antibodies against the virus, and so they learn how to fight the virus. But for that to happen,
all right, we seem to be having an audio trouble with you there, Dr. Jindal. We're going to perhaps try and reconnect.
We can say that there is herd immunity, and then the chain will be broken, because whenever virus goes to a person who has good immunity, it will not be transmitted further.
All right, very interesting perspectives there coming in on immunity and on chances of relapse. Now that's a very real question that not just India but a lot of countries all over the world are actually looking at. Countries that have flattened the curve, countries that are now mulling relaxation and lockdown are in fact looking at this question of relapse. But if I could just come back to the question that I'd asked initially, which is on perhaps a rethink in the number of days one should self-isolate for. Doctors have primarily prescribed 28 days, but do we at this juncture, when so little is known about the disease, have any concrete evidence to say that maybe 28 days of self-isolation safer than 14 days perhaps, if any of the doctors want to take that on?
The longer that period of quarantine, the longer is the safest disease. That's even for a society, even for an individual. If you contain yourself for a longer period, the chances of spread of the disease as well as the risk to the society is less. That we know from various studies. Right? Longer the quarantine. If you have a lesser quarantine period, then chances of relapse in that society is very high. If you increase the quarantine period, then chances of relapse in the society is also less.
All right. Wanda from Meghalaya is joining us on the broadcast as well. Ask your question.
Hello, sir. I have a question. There is a case, who has never been anywhere, who doesn't have a travel history. So, is it possible that the original patient is asymptomatic and asymptomatically transferring the virus to the patient?
All right. Questions, of asymptomatic transmission have been, a lot of such questions have been asked. Dr. Trivedi, do you want to address some of those concerns? Asymptomatic carriers, people who have no travel history, but, could have come in contact with a patient who doesn't even know that they're positive.
Sure. I think this makes the most important group. I think majority of people who are contracting illness is because of the asymptomatic virus groups. If you look at society, if I'm symptomatic, I'm coughing, I have a problem, people will go away from me, especially these days. But then the patients who are, I shouldn't call them patients, actually they're carriers. Like many of us may be carriers without knowing it. And not only we are directly communicating to the environment through the droplet, but also through fomites. Like I'm touching some handle of the door, knob door of the toilet or somewhere else.
Right.
And then the next person comes and touches it and in the process gets the virus.
So, which is why I think, what we're seeing happen today, which is an extension of the lockdown, is imperative in order to be able to contain the disease. Because if you're out there in the open, you have no way of controlling how many asymptomatic carriers you could perhaps, come in contact with. But, this again brings me back to the self-isolation quarantine period. Given the fact that now we're witnessing these 5 cases with a 3-week-old travel history, asymptomatic cases on the rise as a precautionary measure. And if I could ask you perhaps, Dr. Jindal, as a precautionary measure, would you recommend that, perhaps people should look at a more elongated period of quarantine?
See, it all depends on persons, how immunocompetent a person is. If somebody is healthy and is immunocompetent, then even if the virus invades him, he may not develop symptoms. And then if he develops milder symptoms, he will overcome it with his good immune system within a matter of 2 weeks or at the most 3 weeks. So probably 3 weeks should be the average quarantine time for these milder patients. But the patients who probably developed the severe disease, had been having fever and some signs of pneumonia,
right.
Maybe in those patients, it's always better to give them a quarantine time or a period of isolation for at least 4 weeks.
All right, 4-week period of isolation just to be on the safer side, given the fact that there is so much unknown, about this particular disease, and asymptomatic carriers, of course, has been a very big cause of worry for health workers across the world, really. Sardar Sheikh joining us from Ahmednagar. Go ahead.
Yeah, good evening.
Good evening. Go ahead.
Yeah, I want to ask one question. The patients who are having diabetic symptoms and as well as heart diseases, can they use a simple mask or N90 mask is necessary for them to have protection?
All right. Dr. Singh, do you want to take that on? You're also a professor of diabetes. Is there any extra precautions or a special mask that diabetes patients should be using?
No, simple mask is good enough. There's no need of wearing the surgical mask or N95. There's no need. Simple mask is good enough.
All right, and there's been and there's also been a rethink on the idea of wearing masks. It wasn't mandatory first, but statistics have shown that wearing a mask actually reduces your chances of transmission. And there've been a lot of questions, Dr. Jindal, on on how long particulate matter can actually remain suspended in the air as well. But before I ask you that question, Nitish is calling from Gurgaon. Go ahead.
Yeah, I'm Nitish calling from Gurgaon. Just I wanted to know from the panel of doctors that I am having blood pressure and I took medicine and I take medicine. So am I so vulnerable as the other people are because my blood pressure is under control? So can I be my immunity can be like a factor for having corona?
Dr. Trivedi, would you want to take that on perhaps? Because I mean, you're a cardiologist, you deal with presumably heart patients taking BP medications as well.
Sure. First of all, you have to understand that you being hypertensive doesn't predispose you to corona infection. See, the information what you're getting is that in case you get corona infection, not because of predisposition, but otherwise, then the prognosis may not be as good. But what I will suggest that don't get panicked. This is the problem which the India is facing, that everybody is getting panicked. From your voice, you appear quite young to me. So just continue to take your medical treatment for hypertension. Don't get panicked, and I'm sure you will do well.
All right. So it's important not to panic and important to take all of those precautions as well. But Dr. Jindal, if I could just come back to the question that I was asking you, about masks being made mandatory, that's been a bit of a rethink that has happened, but all over the world in different parts now masks are mandatory, and a lot of speculation really over how long, particulate matter can stay suspended in the air.
See, there are two ways. The disease which is infectious, if it is spreading through aerosol, then it's highly infectious and contagious. And then the spread is very widespread. And if it's spreading through droplets, droplets are slightly bigger particles, they cannot remain suspended in air for more than 3-4 hours. And so they have to fall down on some surface, and then somebody touching that surface will definitely spread the infection. So
all right. Our next caller, Ahmad is on the phone line from Srinagar. Go ahead.
Yes, sir. I have a question about this coronavirus.
Go ahead, ask your question.
Yeah, I've come from Dubai and it's almost been 30 days now, but I don't have any kind of symptoms about the coronavirus. Is it still possible that I'm going to have, if I go for a test about this, it's going to come positive?
Dr. Singh, would you like to take that on?
It is almost 30 days he has come from Dubai.
Yes.
I personally that he is very much okay. He has to know not to worry about anything. I will certainly say, okay, he's fine.
All right. I'd like to bring in Dr. Trivedi as well over here because, you're Dr. Trivedi, you're joining us from Bhopal. Bhopal has been, among one of the very badly affected cities in the country by the coronavirus, a lot of positive cases. But if I could just ask you, 30 days, if a patient has come, if a person has come back, they're healthy, they don't exhibit any symptoms, chances are that, they are healthy and won't have any symptoms. So what if somebody wants to go and get tested? Today there was a bit of a conflicting opinion coming in from the government as well. ICMR saying anyone can walk in and go get tested. Government saying that no, there are several criteria. So if a person with a 30-day travel history wants to go and get tested, just any way to remove doubt, can they do that?
I think for this ICMR guidelines are clear. They say within 14 days of a travel abroad, even if the person is asymptomatic. Now, the problem is that with the limited resources of testing, government has clamped down certain rules and which we should look into.
Right.
Now, about the scholar, another problem is there. Though he has come back after, say, 30 days before, but what stops him from getting this disease locally?
All right.
You see, so unless if he becomes symptomatic, then yes, probably he needs to go for a testing. But if he's asymptomatic, so let's preserve our national resources.
All right. Mary from Tuticorin is joining us with the next question. Go ahead, Mary.
My question is open. The number of cases in Kerala is 386. The number recovered is... The number of cases in Kerala is 386.
Ask your question.
The number of cases in Kerala is 386. The number recovered is 211. My question is, while all other states struggle to get their patients recovered, how come that Kerala is very good in this? Why don't the other states follow and get the help and suggestions from Kerala?
All right. So recovery rate, Dr. Jindal, if you want to take that on, recovery rate faster, in Kerala. Kerala has been looked at as a model, one of the states that's flattening the curve sooner than the others. What would you attribute as some of the good practices that Kerala is following, which perhaps the country could be inspired?
See, Kerala, there is very high education rate, and then they are also very disciplined people. So probably that is the reason that they are following the restrictions very well. And so spread is not that fast as happening in the other states. So maybe that is the main reason. Otherwise, they had very large number of cases initially, but now they have shown that it's not.
Yes, a large number of people with a travel history, were found to be positive. Among the first cases were actually reported in Kerala. Murli Menon from New Delhi is the next caller. Go ahead.
Yes. Hello.
Yes, go ahead, sir. Ask your question.
Yeah. Myself, Murli Menon. Basically, I am also the founder of World Water Therapy Day. So I have another interesting question related to mathematics and COVID-19.
Okay.
So my question is, see, when the coronavirus gets activated, because I read somewhere it is a ball shape, when it becomes half, it gets activated. So what is the process on this, sir?
All right. Dr. Singh, do you want to take that on? Is there any mathematics associated, with the virus being activated?
No, there is no mathematics in the, spread of the virus. There is a mathematical model is there that if the one person is affected, then another, then the line, then mathematical model is there as such for the spread of the disease. But as far as the coronavirus affecting man, any mathematics in that's not there. Corona is as such, it's a virus which has RNA and a capsid around it. It becomes active only when it goes into another cell. It destroys that cell and produces the disease.
All right. So I hope that answers your question. N. Mohan from Kottayam is with us on the broadcast as well. Go ahead.
Yes, I'm Malan Mohan calling from Kottayam.
Yes,
sir, are there any types of medicine that treat against COVID-19 right now? Is there any possibility?
All right. Medication and drugs against COVID-19, I think that's been one of the most frequently asked questions here on the broadcast as well. Dr. Jindal, Dr. Trivedi, would any of you, like to address that?
See, right now some of the antiviral drugs have been tried, and most of them were previously tried either in Ebola virus or sometimes in HIV viruses. One medicine which recently has come to the light is remdesivir. There are some reports, very recent reports in a very good journal, New England Journal of Medicine, on 10th of April only, which showed that something like 50 to 60% patients were benefited to some extent who received this drug. But this was an open label observational study, so some more randomized clinical trials are needed so that we can say that this is actually.
All right, I have time for an absolute last caller, Shafat, joining us from Srinagar. Shafat, if you could keep your question short, please.
Yeah, it's very short. I'm just 63 years old. This is Shafat. I am just 63 years old. In the year of 2030, I had just stent at my LA level. shall I consider myself a cardiac patient and have to take some? Though I take medicines, I take brilliant or 60 I take, and I take other drugs also. But should I consider myself vulnerable for this COVID?
All right. Very quick answer. Dr. Trivedi, would you like to comment on some of those drugs, whether they should be taken or not?
See, let us understand one thing. COVID or no COVID, your illness remains. So let me reassert that you are a cardiac patient. That's why you're taking the medicine. And COVID is in no way going to change it. Only thing is, if you develop a fulminant infection, you may have chances of more complications. And what I would like to, through your channel, I would like to tell, lot of messaging in the community that please don't go to the hospital. I would like to tell all my cardiac patients, if they have chest pain, chest difficulty, breathing difficulty, please do visit hospital. Corona is going to kill only 2% of the patients, but heart disease will kill 13%.
I think that's a very important message that, Doctor, and thank you for clarifying, on several of those. A big thank you to all the 3 doctors who've joined us. Thank you for your time. You've been very kind to take on all the questions, and a big thank you to viewers who've dialed in as well. That's all we have time for on the show this evening. Thank you for watching.